Good afternoon. I'm Dr. Vijay Iyer. I'm a cardiologist at Kaleida Health and the University at Buffalo. This is HealthyU, presented by Kaleida Health. We are going to be talking about the cardiovascular manifestations of COVID-19. Most of you are aware of the huge impact COVID-19 has made on our communities, not just in the United States, but across the world. At this point, as per the Johns Hopkins website, there are more than 1 billion cases of COVID across the world, with about 2 million deaths across the world. The largest impact in terms of the largest number of cases has been felt in the United States, Brazil, and India, but there are no countries that have been spared COVID anywhere in the world. We have learned through this pandemic that advanced age and concomitant cardiovascular disease are the highest confounders of poor outcome, and we're going to talk a little bit about the cardiovascular outcomes or the cardiovascular manifestations of COVID and what can be done to avoid or prevent it. This is the proposed mechanism of transmission of the SARS-CoV-2 virus. This is a coronavirus that we believe originated in bats, and through an intermediary, which we believe is the pangolin, was transmitted to humans, initially in China, and then from there was spread to the rest of the world. The mechanisms of transmission are still being worked out, and there is some debate and controversy, but in general, we do believe that the origin of the virus was a bat virus. We know the clinical manifestations of COVID-19, and many of you have heard about the most common manifestations being fatigue, fever, chills, and a number of other manifestations, including in substantial numbers a gastrointestinal manifestation, which is diarrhea. While the COVID-19 pandemic started both in Europe and in the United States, there was another observation that became quite obvious, which was that there was a substantial increase in cardiovascular deaths, which could not be explained merely by COVID-19 related pulmonary manifestations. So we know that the lungs are impacted the most by COVID, and many of the initial deaths were related to respiratory failure, but we saw an increase in deaths related to cardiac issues, and this is data from New York City, the Department of Health, where there was an increase in cardiac arrest 911 calls, there was an increase in cardiac arrest deaths. And when you look at the proportion of COVID-19 confirmed deaths, there was a disproportionate number of cardiovascular manifestations. We do believe that two factors were in play here. One, that people who had cardiac disease probably delayed their care and did not go to hospitals. The second is possible that there was truly a cardiovascular manifestation of COVID-19 itself. This is data from Italy, which looked at excess deaths relative to 2016. And when you look at official COVID-19 fatalities, which were related primarily to respiratory problems or lung problems, there was a substantial increase relative to what would have been predicted, which we believe is related to cardiac issues. These are the stages of acute disease in COVID-19 in terms of its progression. We see an initial viral response after infection that shows up as a decrease in the lymphocyte counts in the blood cell, which then proceeds when the lungs get involved with abnormal imaging in the lungs, and oftentimes people have respiratory difficulty like shortness of breath. And eventually, in some people, not everybody, we see a hyperinflammatory, wherein they have a severe manifestation of the disease, both in terms of their lung tissues as well as potentially the heart. Let's talk a little bit about the cardiac manifestations of COVID-19, and this slide shows you all the possible things that can potentially happen with COVID-19 infection. Fortunately, not a large number of people with COVID-19 infection show cardiovascular manifestation, and it continues to be a small number. But what we do know is that those people who have concomitant heart disease, so if you already have heart disease, you're more likely to have these manifestations. But for people who do not have heart disease and who may be very healthy, even they can get manifestations in their heart from COVID-19. So in terms of the manifestations, what we can see are what you can see down here. We can see decompensated heart failure, acute coronary syndrome, meaning somebody presenting with a heart attack, myocarditis, which is not uncommon, and sometimes it's mild, but it exists, and we have seen this even in young, healthy athletes, where there is an inflammation of the heart muscle, and some people show up with low blood pressures. There are also instances of abnormal rhythms of the heart. some of it directly related to COVID-19 infection, and as I'll show in a subsequent slide, may be related to some of the medications that were used originally in the treatment of COVID-19. These are some of the manifestations of COVID-19, and these are clinical examples of the kinds of manifestations people have presented with. This is a 64-year-old woman who presented with what appears to be an acute heart attack. The angiogram, which is manifested in B, shows normal blood vessels. You can see good flow. These dark lines show normal blood vessels. But you can see that the lungs look like there was infiltrate, meaning that the lungs did not look normal, and the heart function was significantly diminished. Now, this is somebody who had what appears to be a fulminant myocarditis, meaning an inflammation of the heart muscle, causing a decline in heart function and sending them into heart failure, which was acute, which looked like a heart attack, but really wasn't because the blood vessels were open. This is a second presentation, and this is also related to decompensation of heart failure. This is a patient who had known heart disease and developed COVID-19 infection and ended up developing a worsening of heart failure because of the COVID-19 infection, including presenting with an abnormal rhythm of her heart. Some of the manifestations of COVID-19 impacting the heart have been extreme, meaning people have needed to be put on ECMO, which is a form of life support, wherein a machine takes over the functioning of the heart as well as the lung. And this is a manifestation of a young 38-year-old, but with comorbidities, meaning other medical issues that may predispose them to problems. And that included in this individual diabetes. And this individual ended up with heart failure that needed them to be placed on an ECMO machine to be able to tide them through. One of the other things we noticed early on in COVID-19 infection is that people who got COVID-19 infection were more prone to form clots. These clots were sometimes in their leg veins, causing what we call a deep vein thrombosis. Some people presented with clots that ended up in their lungs, which is what we call a pulmonary embolism, causing them to be short of breath. Some people had clots that ended up in their brain arteries, causing strokes, and some people had acute heart attacks manifesting because of clots in the blood arteries that supply the heart muscle. And multiple studies now have shown that there is an increased propensity to form clots when you get a COVID-19 infection. The more severe the COVID-19 infection, the higher the propensity to form clots. We are still uncertain as to what is the most appropriate way of treating these individuals, whether they should be just on a little aspirin or a stronger blood thinner, but these are some of the areas of research that are ongoing. A little bit about how we think we get heart manifestations because of COVID. We believe that the primary problem could be in the lungs, which can subsequently impact the heart muscle, or there could be direct involvement of the heart muscle because of the SARS-CoV-2 virus, or it could be an inflammatory response to the viral infection that indirectly attacks the heart muscle and causes the problem. So all of these can manifest themselves as either abnormal rhythms, weakness of the heart, or what appears to be a heart attack. This is not to get too technical, but this is the proposed mechanism of how the SARS-CoV-2 virus, coronavirus 2, causes cardiac damage. It appears that there is a protein called the angiotensin-converting enzyme 2, through which the virus attaches itself to cells and gets into the cells and causes an inflammatory reaction that causes damage to the heart muscle. Many times, these biomarkers can be measured in the bloodstream to determine how severe the infection is, and they're often elevated because of the inflammatory response. And here we are talking about when do you start to see it. Now, we all have seen the manifestations of the acute problems, people presenting with fever, shortness of breath. Some people will have cardiac manifestations. We know now that majority of people will recover from this and will be in a convalescent state. But we are starting to learn that for those people who have had a COVID infection, mild or serious, may often have long-lasting effects from the coronavirus infection, possibly in their lungs and in their heart. And these are areas, again, of research. We don't yet completely know the time course and how long these may last or whether this damage is permanent. But there are people who show fibrosis in their lungs. There are people who show diminution of their heart function. And we don't know whether this is completely recoverable or there are certain long-lasting chronic changes that will develop from from a COVID infection. There are multiple trials, and this is just a schematic. The idea is that we are now starting to understand a little bit more about how COVID, coronavirus 2 infection affects us, and multiple different therapies are being developed, including some in trials that will include the use of stem cells, both adult stem cells and embryonic stem cells. These trials are ongoing, and we have no definite answers yet. There are multiple trials of antiviral agents, some of which have been approved by the FDA. As you're aware, these are available for treatment in more severe forms. In most cases of COVID-19, it is self-limiting and people only need supportive care, but a small number will progress needing additional medical therapies. Not to diminish the importance of what we know already about preventing the disease. We know masking prevents spread of disease. We know hand washing prevents spread of disease. We know social distancing prevents spread of disease. So I think from a community standpoint, all of those things are as important as everything else that's going on in the medical community with terms of research and trying to develop treatments for those people who are infected with the virus. So we have a couple of questions that I will try to address. The first question was, do we know yet why patients are having elevated baseline increase in heart rates and episodes of what's called sinus tachycardia or a increased heart rate a year after infection? We don't know for certain yet. We believe that there are some residual changes which may be impacting the lung function and the heart function that will manifest themselves as increased heart rate. I think there's a lot of research going on as to what are the chronic changes that occur after a coronavirus infection. And hopefully over the next couple of months, we will have more answers. The second question was, are these heart manifestations mainly seen in a certain demographic of patients? So there's a couple of answers to this, and I think it's important we understand the differences between the different mechanisms. For those individuals who get a very severe form of the COVID-19 virus, we believe that there may be some genetic factors that may predispose to them. They will get manifestations of the cardiovascular system simply because of the extent of the disease in the primary place. For those people who have known cardiovascular disease, whether it be in the form of hypertension, known heart disease with blockages, previous stents, previous heart attacks, previous heart transplant, previous coronary artery bypass surgery, or aortic or any kind of valvular surgery, those patients are prone to have a more severe form of COVID-19 infection. And the last part is for those people who are healthy young individuals. A small and a very small proportion of them will show cardiovascular manifestations, and it is unclear at this point what specific predisposing factors exist in them. And I'm sure you've seen in the public domain instances of young individuals, including professional athletes who have had COVID-19 infection and involvement of the heart with a condition called myocarditis, which may not be disabling but sufficient that it precludes these individuals from participating in high-level athletic activities. We don't know why only certain individuals get it and certain individuals don't. So it again is an area of research, but certainly the idea that I would like to convey to people is that while we still are trying to understand that there are certain things we already know we can do to prevent these manifestations, which is really social distancing, masking, and for all of us when the vaccine becomes available for general use to get vaccinated at the earliest. If you're somebody who has known comorbidities, I think you must, I think it is extremely important to volunteer yourself to get vaccinated and avail of the opportunity as soon as it becomes available in your area. The other question was, what role does smoking play? I think we know that those people who are smokers are probably more prone to getting the pulmonary manifestations of COVID. And it's not just cigarette smoking. We know that vaping is about as bad as smoking. And we believe that both of those are responsible for some of the manifestations or the extreme manifestations of pulmonary disease we have seen in people with COVID-19 infection. The next question is, how do you know if you have heart damage post-COVID-19? Most of the time, this can be done with simple physical examination, including an electrocardiogram, as well as an echocardiogram that can look at your heart function. Sometimes the manifestations of heart damage are extremely subtle, and you will need a more refined test like a cardiac MRI to determine if you have any damage to your heart. I think we are close to our time, and I appreciate the opportunity to present. I thank you for your participation and attention. This is HealthyU from Kaleida Health. Thank you again.